Hello, I'm Martin Park. You can call me Coach. Welcome to the channel. Today, I'm going to talk about the role of nutrition in managing chronic health conditions. What are chronic health conditions and how are they typically managed? Chronic conditions are long-term health conditions that often require ongoing management to control symptoms and prevent complications. These conditions can include diseases like diabetes, heart disease, autoimmune disorders, and certain types of cancer, among others. Depending on the condition, management strategies might include medications. Many chronic conditions require medication to help manage symptoms and prevent complications. For example, someone with type 2 diabetes might take oral medications or inject insulin to regulate blood sugar levels, while someone with hypertension might take medication to lower blood pressure. Lifestyle changes. Lifestyle changes can play a key role in managing chronic conditions. For example, someone with heart disease might need to make changes to their diet, exercise routine, and stress management practices to help reduce the risk of heart attacks or strokes. Similarly, someone with an autoimmune disorder might need to make dietary changes or incorporate stress-reducing practices like meditation or yoga to help manage symptoms. Ongoing monitoring. People with chronic conditions often need to monitor their symptoms and health markers on an ongoing basis to ensure that they are staying on track with their management plan. This might involve regular blood tests, check-ins with a healthcare provider, or self-monitoring of symptoms like blood pressure, blood sugar, or pain levels. What is the link between nutrition and chronic conditions, and how can the foods we eat impact disease risk, progression, and management? The foods we eat can have a significant impact on our overall health and well-being, including our risk for chronic conditions like diabetes, hypertension, and autoimmune disorders. Research has shown that certain dietary patterns can increase the risk for these conditions, while others can help prevent or manage them. For example, a diet high in added sugars, refined carbohydrates, and saturated and trans fats has been linked to an increased risk for type 2 diabetes, heart disease, and other chronic conditions. This is because these types of foods can lead to insulin resistance, inflammation, and other metabolic imbalances that contribute to disease development and progression. On the other hand, a diet rich in wholesome, nutrient-dense foods like fruits, vegetables, whole grains, lean protein, and healthy fats, eaten in quantities and balance that your body requires, can help reduce the risk of chronic conditions and support overall health. This is because these types of foods contain a variety of vitamins, minerals, antioxidants, and other beneficial compounds that help support optimal body function, reduce inflammation, and support disease prevention and management. Nutrition in our diet can also be a powerful tool for managing chronic conditions and improving overall health outcomes. Here are a few examples. Consuming foods that are rich in omega-3 fatty acids and monounsaturated fats, such as fatty fish, nuts, seeds, avocado, etc., can help reduce inflammation, improve cholesterol levels, and support heart health. Similarly, consuming probiotics found in foods like yogurt and fermented vegetables may help manage symptoms of irritable bowel syndrome. For others, eating frequent small meals throughout the day may be beneficial for managing blood sugar levels in people with diabetes, reducing added sugars. A diet high in added sugars has been linked to an increased risk for chronic conditions like type 2 diabetes and heart disease. To reduce your intake of added sugars, focus on eating whole, unprocessed foods and limit your consumption of sugary drinks, desserts, and snacks. Increasing fiber intake. Fiber can help regulate blood sugar levels, lower cholesterol, and promote healthy digestion. To increase your fiber intake, aim to include plenty of fruits, vegetables, whole grains, and legumes into your diet. Reducing salt intake. For people with hypertension or heart disease, reducing salt intake can help lower blood pressure and reduce the risk of complications. To lower your salt intake, focus on eating whole, unprocessed foods and avoid adding salt to your meals. Antioxidants. Antioxidants like vitamin C and E, beta-carotene, and selenium can help protect cells from damage caused by free radicals, which may contribute to chronic diseases like cancer, heart disease, and Alzheimer's disease. Foods that are high in antioxidants include fruits, vegetables, nuts, seeds, and whole grains. Vitamin D. Vitamin D is important for bone health, immune function, and may have a role in preventing chronic diseases like diabetes and heart disease. Foods that are high in vitamin D include fatty fish, egg yolks, and fortified foods like milk and cereals. Vitamin D can also be synthesized by the skin through exposure to sunlight. Calcium. Calcium is important for bone health, muscle function, and nerve function. Calcium deficiency can contribute to osteoporosis and other bone disorders. Foods that are high in calcium include dairy products, leafy green vegetables, and fortified foods like orange juice and cereal. Adequate hydration is also very important for maintaining overall health, and it is especially important for individuals with chronic conditions. Staying hydrated can improve the absorption of medications, which is especially important for individuals with chronic conditions who may need to take medications on a regular basis. It also helps to maintain organ function, including the kidneys, which are responsible for filtering waste and excess fluids from the body. This is important for individuals with chronic kidney disease who may already have compromised kidney function. It helps regulate body temperature, which is especially important for individuals with conditions like multiple sclerosis or heat intolerance. It helps to improve digestion and prevent constipation, which is important for individuals with conditions like inflammatory bowel disease. It reduces the risk of complications. Chronic conditions like diabetes and cardiovascular disease can increase the risk of dehydration, which can lead to complications like kidney damage and blood clots. So staying hydrated can help reduce the risk of all these complications. Some tips for staying hydrated are: aim to drink water throughout the day rather than drinking a large amount at once. Check the color of your urine to determine if you're hydrated. Clear or pale yellow indicates good hydration, while dark yellow or amber can indicate dehydration. Limit alcohol and caffeine. Alcohol and caffeine can increase dehydration, so it's important to limit intake of these beverages. Overall, the link between nutrition and chronic conditions is complex and multifaceted, but by understanding the link between nutrition and chronic conditions and making dietary changes that support optimum health, you can help prevent or manage these conditions and improve your overall quality of life. And I believe the best way to do this is with the assistance of a healthcare professional, as a professional healthcare provider can help you develop a personalized nutrition and lifestyle plan that takes into account your specific health needs and goals. Managing chronic conditions can be a complex and ongoing process, but with the right strategies in place, it is often possible to control symptoms and prevent complications, allowing people with chronic conditions to live full and healthy lives. I wish you all the best with your personal journey toward a healthier and more productive life, and should you need my assistance, then please reach out via my website. I thank you for watching, and I look forward to spending some time with you again. Bye for now.